Good evening. My name is Dr. David Doman, and welcome to another edition of Housecall. Do you or a loved one need access to medical marijuana? Find out about that program right now. Joy Strand, Director of the Maryland Cannabis Program in Maryland. Ms. Strand, welcome to Housecall.
Thank you, Doctor. Glad to be here.
Our pleasure. So briefly tell our viewers about your professional background and how you came to be director of this important program.
I am a healthcare professional. I spent my entire career working in hospitals. I was a medical technologist. I was a quality director. I was into regulatory matters in healthcare. My last two assignments before the commission were as CEO of two health systems. So I have a lot of background and experience in running health programs, building health programs. I joined the Medical Cannabis Commission in December of 2017.
So what was the rationale at a state legislative level for creating this program?
The program was created in order to provide patients across Maryland with alternative medicines that may not have provided them relief in what they were experiencing with traditional medications.
And when was this program first established?
The original legislation was passed in 2011. It went through many modifications until the first product was available to patients in December of 2017.
So it's been around for a while now. What kind of patients are qualified to enroll in this program?
There are specific conditions of which patients have, and they work with their physician to become qualified. The most prevalent conditions are chronic or severe pain, and the other most prominent condition is a condition for which other treatments have been ineffective.
Okay. So if somebody has pain, are we talking about back pain or headaches, or what kind of pain are we talking about?
Any kind of pain would qualify if it was debilitating and severe for the patient.
Right.
That medical cannabis could be effective for and improve their quality of life.
If you have pain and you want to qualify for the cannabis program, do you first need to demonstrate that more conventional therapy has been tried and failed, or are you allowed to go straight to this program?
The entrance into the program is a two-step process. The first, a patient would need to go to our website and register with the commission as a patient. And the second,
what is that website, if I may ask?
It is mmcc.maryland.gov.
Okay.
And the second step is for them to visit a participating provider and become qualified through an examination and a discussion with their provider of the benefits, potential benefits of medical cannabis for their condition.
What if somebody doesn't have physical pain and yet they have emotional pain? Let's say a vet who has post-traumatic stress syndrome or chronic anxiety, depression. Do those emotional issues qualify for a program like this?
Post-traumatic stress syndrome is a qualifying condition. The other ways that people can qualify through their unique circumstances is talking with their physician. If traditional medicines have not helped, traditional therapies have not helped, they are able to be qualified through the other category for a condition that has not been able to be helped through other means.
What other types of conditions besides physical pain or emotional stress do you see patients presenting for enrollment to be considered?
The qualifying conditions include seizures. Let me think if I can think of the whole list. Nausea for cancer patients,
Okay.
things like that with chemotherapy side effects.
Right.
Wasting syndrome. And that's about the broad list, with pain and post-traumatic stress, and then the other category is very inclusive.
And do you find many cancer patients are enrolling?
We do. We
Yeah.
find many cancer patients are enrolling. We have special qualifications for patients who are in hospice. We do have, because we're getting so many applications into the program, there is a delay of about 10 to 12 days before a patient can become registered. However, hospice patients take priority, and they do not have to wait in the queue. They're processed immediately and become registered right away.
Okay. So a patient has to enroll on the website,
Yes.
plus they have to be first seen by a qualified physician.
Who is also registered with the
Right.
commission.
That's what I was about to ask.
Yes.
So how does a community physician enroll to be a recognized physician in this program?
Physicians were originally the only providers that were eligible. However, that category has now been expanded, and we now say provider rather than only physician.
Okay.
So the qualifying providers can be physicians, nurse practitioners, certified nurse midwives, podiatrist, or a dentist.
A podiatrist. Why podiatrist?
There are a lot of people with chronic foot pain
Okay.
or other ailments of the feet that would possibly be helped with medical cannabis. Nobody likes to walk around with sore feet, and so we hope that that helps improve their quality of life. Providers that are interested in becoming registered also go to the website and register online there, and they create their own personal profile. And that is also the way that a provider would certify a patient, is they go into their profile and put in the patient identification number that establishes a relationship between the two on our database, and goes from there.
And how long does it take for a provider to be certified by the program?
And it's pretty quick. There's not the waiting. For example, we have 53,000 registered patients in Maryland, and we have 1,000 providers.
Right.
So we are looking for more providers to
Right.
become active in the program.
So a patient qualifies for the program and is certified by an appropriate provider. What happens then? How does a doctor go about prescribing the marijuana?
It's not the same as in the traditional sense where a provider would write a prescription.
Right.
The provider goes into the database and certifies the patient. The default amount that the patient can receive is 120 grams of cannabis per month, in a rolling 30-day period. The provider has the option to shorten the time frame or lessen or increase the amount based on the patient's condition. And that is the only thing they need to do. They don't write out a prescription or anything like that, because our database is all electronic. And once the patient is certified by the provider, they're eligible to go to a dispensary, and the dispensary can see the information that that patient is allowed, what amounts they're allowed, and over what time frame they're allowed to have it.
Translate for our viewers what you mean by 120 grams. What does that turn into? Are we talking about individual joints, so to speak, or are we talking about capsules, or in what form is this being distributed?
The traditional method of cannabis is what we call flower, and now we have also processors that transform that flower into different cannabis products. We have tinctures, salves, balms, oils. I saw a new product of Epsom salts for a cannabis soak. So there's a lot of different methods of taking the cannabis. There's tablets, there's capsules, there's creams. All of those types of things are manufactured.
And how is the dosage form determined? Is it by the patient, the physician, or the program? I mean, in terms of what the patient ends up getting.
It is calculated based on what the provider has authorized,
Right.
which is generally 120 grams.
Right.
And then the dispensary enters the sale into our database, and we calculate the amount that they've purchased from the amount that they have available.
But is it determined by the dispenser whether it's going to be a capsule or whether it's going to be something that they're going to smoke, or who makes that decision?
The patient can choose whatever product
There's
they
a
like.
choice. Okay.
Some patients don't like to smoke.
Right.
Another popular method is vaping.
Right.
As it happens in Maryland at this point in time, 60% of the products that are sold in dispensaries are processed product rather than smokable flower.
Right. So they may ingest it.
They may ingest it.
Right.
It may be a tablet or something like that. The older folks are usually looking for something other than smoking.
Right. Now, as you know, there are different subcategories of cannabis. For example, there's something called CBD oil,
Yes.
which has gotten a lot of positive press recently for relieving pain. And it's said not to have any hallucinogenic properties.
Correct.
So do you, whereas the marijuana you're dispensing, whether it's ingested or smoked, I presume does have some mood modifying effects?
It does depend on the concentration of the
Right.
product.
Yeah.
There are products out there that are very high CBD and very low THC.
Okay.
They would not have as great of hallucinogenic effects. Flower most always has hallucinogenic effects, so
Right.
if you're smoking, you're going to get that euphoria. But a lot of the topicals or some of the vaping products or some of the tablets are more of a blend of CBD and THC. All of the concentration information is on the product, so the
Right.
patient can be educated and know exactly what concentration they'll be ingesting with their product.
So somebody then receives a prescription for 120 grams, whether it's to be smoked or ingested or an oil. What does that 120 grams per month cost?
Well, the processed products tend to be a little bit more expensive, but I can tell you one of the popular amounts of sale is an eighth, and I would say roughly, there is a range of cost, but roughly an eighth is about $50 right now. So if 120 grams translates into about 4 ounces, it's somewhere around $1,600 a month.
Really? So it does add up. And then that's out of pocket for the patient?
It is. It's an all-cash business. There
Right.
are no insurances that cover cannabis.
Right. And does the state provide any subsidies for people who can't afford it?
Not at this time. One of the things we are looking at developing into the future is a compassionate use fund, and we're just starting to look at that for patients that are on Medicaid or in the veteran program.
All right. Well, this has been a very, very informative first half of the show. We're going to pause for a moment. More with my guest, Joy Strand, and the Maryland Medical Cannabis Program. We're going to have a public service announcement. We'll be right back.
It takes less than 1 minute to find out if you may have prediabetes. You can do it here. But I get it, you're busy, and busy people can't have prediabetes. I read that wrong. They can, okay? Just go to the site.
We're back. My guest this evening is Joy Strand, Director of the Maryland Medical Cannabis Program. Ms. Strand, when we paused for the break, we were discussing how to be qualified as a patient or a physician to participate in this important program. Let's go on to discuss two other components of this program, the growers and the dispensaries.
Okay.
So first of all, is all of the medical marijuana dispensed in Maryland grown within the state?
Yes. Every cannabis product sold in Maryland is from a plant that was grown in Maryland.
And how does one, as a farmer, a grower, qualify for this program?
There was an application period but for processors and for dispensaries. So that application was performed a couple of years ago. Licenses or pre-approvals were awarded, facilities were developed and inspected by the commission, and they had to meet certain requirements in order to become licensed. So the commission regulates all of the licensees in those three categories.
What kind of health or safety criteria do you have for these growers?
There are strict controls for growing and processing in dispensaries in regard to developing the product and the different methods that they're using for processing, as well as good security so we can avoid diversion of product.
That's what I was going to ask. I mean, do they have like these high security fences and you know, security guards to prevent theft?
All of the licensees are required to have video surveillance 24/7. They're very regulated about who can come in and who can come out. You really can't get into a dispensary unless you are a registered certified patient. The grow facilities are pretty much protected through fencing and security and lock gates and things like that.
The dispensaries, how many of them are currently in the state of Maryland?
Currently, we have 65 licensed dispensaries, and we have 37 that are still in pre-approval stage that we're working on licensing now.
So eventually you'll have about 100.
102.
102. And how does one qualify to become a dispensary?
Again, through the application process and through the regulatory process, the commission has made very specific regulations for all of the licensees in the building design, the building security, what is allowed to be displayed, how the patients can be sold to, who can handle the product, where it's stored. All dispensaries have a vault that they need to keep their product in.
Sure.
With very limited access.
If a patient qualifies for the program, can they find these dispensary locations on your website?
Yes, all of our licensees are listed on the MMCC website under the industry tab.
Recently there was a flurry of headlines in Maryland that dozens of patients got sick when using illegal marijuana, not marijuana regulated by the state. And part of that was, unfortunately, some of the marijuana was cut with strychnine, rat poison, which led to uncontrolled hemorrhaging. What is being done on a state level to deal with that issue?
When those reports came in about the illicit or the synthetic cannabis, we were alerted, and we did alert all of our patients through the website and our licensees as well. One of the things that sets a medical cannabis program apart from illicit marijuana is the fact that every product, every batch of cannabis harvested is tested through strict criteria. We now have 5 independent testing laboratories. And so all of our products is tested for a variety of components and purity and concentration.
If somebody is a qualified patient, let's say they have cancer, but they're still at home, and they're using this product, do they receive some sort of ID card that indicates that they are a qualified member of this program?
As I said, everything is done online, so the first thing they receive from us is an email with their unique identification number.
Right.
That is what they need to purchase cannabis. They'd have the option at this point to purchase a card that is, a little more substantial than a paper email.
Right.
That has their picture and their identification number on the card, and that card is $50 right now. And they can order that right on the website.
If somebody is a qualified plan participant and they use the product in public, is that against the law?
Yes, it is.
So you advise them to do it in the privacy of their home?
Right. When a patient receives cannabis, they sign an attestation form that they understand all of the restrictions and the requirements they have to use cannabis. When they are using legal medical cannabis, according to the regulations, they have immunity from arrest. If they deviate from the requirements of the program, they do not have the immunity from arrest.
So they can be arrested if they use it in public.
Right, if they're using it in a vehicle, if they are driving after ingesting cannabis, if they're in a public park, they're not allowed to use it in those types of places.
Has there been any data statewide or nationally where other states have medical cannabis programs where they followed these patients over a number of years to see if medical cannabis was a so-called gateway drug for abuse of other products?
I would not know specifically any articles to point to. A lot of what we have right now is anecdotal. There have been studies out there. One of the restraints around that is the fact that cannabis is still federally illegal. So there's not a lot of as much scientific research as we would like to have in helping us understand the effects of cannabis, both positive or negative.
Why do you think there's been resistance with the Trump White House to proceed with a federal program?
Well, I think that they have a lot on their plate. I think it's just like in Maryland, it's a controversial, hot button issue.
Yeah.
I think that they're going to talk about it, they're going to bring it up, but which way it goes, I couldn't even guess at this point.
In terms of the program, do you think that the burgeoning success of medical marijuana statewide and then in other programs nationally may lead to just simply legalizing marijuana in the state of Maryland? Other states have done it.
Yes, there are states that have recreational marijuana.
Yeah.
I know that it's been a referendum for the last few years to put that on the ballot. It has failed in each session that I'm aware of. I fully expect it will appear next session and the session after that. There are a great many proponents to legalize cannabis in Maryland. So right now I'm focused on building a great quality medical cannabis program for Maryland.
Well, good for you. Good for you. What about medical cannabis and schools? Are you, let's say you mentioned seizure disorder. What happens if a child has seizures that are poorly controlled by conventional medicine and they need medical cannabis? What kind of accommodations can be done there in a school setting?
Right. These questions are coming up, not only with schools, but with other entities as well. This has kind of changed the game for a lot of organizations. I did meet with the school health coordinators of the state, and we talked through the cannabis program and helped them understand it better. For a minor patient, they are required to have a caregiver that is either their legal parent or guardian. The legal parent or guardian is the only person that can administer the cannabis for the child. So a school nurse cannot administer it or anybody else. The child is not to self-administer the cannabis either. So schools really have to determine what their policy will be and how they will accommodate children who need medical cannabis.
What has been the reaction of law enforcement statewide with the cannabis program? Are they, do you find that there's any resistance, or do you find, if anything, they're happy not to be dealing with what they don't view as a criminal activity?
I think we really have been working with law enforcement to help them understand. I think they want to learn. They want to know more about it. So we have met with law enforcement on many occasions. We've done training for over 650 law enforcement officers to help them understand the program. I think that as we go forward, we learn more and we we find out things that weren't addressed earlier that we now need to start addressing or help improve the program. So the fact that a card was made optional really kind of made it a little bit confusing for a police officer if they were doing a traffic stop and the patient said, well, I'm a registered cannabis patient, and they didn't have a card to legitimize that. So, so we're working with law enforcement very closely to help them understand, and you know, they just want to learn. They want to know about the program. They don't want to arrest patients that are legitimate patients.
Yeah. And what exactly is the structure of your program? I mean, are there multiple offices throughout the state, and are there multiple staff members? How is it structured?
First of all, we are a state agency. We have a volunteer commission of 16 commissioners. The statute specifies the qualifications, education needed for each commission seat. When I started in December, we had 19 staff members, and now, as of today, we have 40.
Wow.
So we're growing very, very quickly.
Very nice.
We have investigators in the field in the 4 different regions, and they're primarily out visiting the licensees, helping them become licensed, getting them up to speed. We have one central office in Linthicum by the airport, where a lot of the staff work out of that office. But we, like I said, we have the field investigators that are in and out and everywhere.
We have 1 minute left. What do you think is the future of the program? What kind of exciting changes do you anticipate in the years ahead?
Well, I think that, you know, we're going to continue to focus on patient safety going forward. We're going to get the rest of the dispensaries licensed. We have some new growers and processors that were pre-approved that will be coming online as licensees in the future. Probably the beginning around next year, we're going to be reopening the application process for growers and dispensaries. We're currently doing educational outreach. We're out there trying to educate minority and women-owned businesses to become involved with the cannabis industry. But first and foremost for us is always to make sure that there's safe product available in Maryland that will really help support patients in their need.
Well, thank you for joining us on Housecall. If our viewers have any questions, how can they reach you?
They can visit our website, and contact information for myself and many other individuals are on the website.
Thank you.
Thank you.
My thanks to Joy Strand for a very informative interview about the Maryland Medical Cannabis Program. My thanks to my terrific staff here at the studio, and thanks to you at home for inviting us into your home. Tell us how we're doing. You can reach me at my practice website, montgomerygastro.com. As for our next show, it's going to be a very interesting one. Dr. Paul DeMarco, a noted rheumatologist, will be discussing Lyme arthritis. See you then next time for another edition of Housecall. Good evening.